Hello, Ms. Elkins. My name is Rasheda Persinger, and I am the nurse practitioner who partners with your doctor. It is my understanding you have further questions surrounding biomarker testing and why it is needed before proceeding with treatment. Is this correct?
Yes, I feel overwhelmed with my diagnosis of advanced lung cancer and all of the new terminology I need to understand. Could you explain again why I need biomarker testing? I read something online about testing for mutations. Is that the same as biomarker testing?
Great questions. Biomarkers are measurable characteristics of your cells that can provide information about your lung cancer. Certain biomarkers are drivers, such as mutations that cause cancer to grow and spread. Mutation testing or molecular testing or biomarker testing are all terms that refer to the same thing. In case of targeted therapies, biomarker testing looks at the genetic makeup of the cancer or its DNA. This is different from the DNA we are born with. This DNA makeup can provide information to guide proper treatment options for your lung cancer.
So since you're only testing the DNA in the cancer, does this mean that I can't pass down my lung cancer to my children if a biomarker is found?
Exactly.
Oh, so therefore, the biomarker testing is providing my doctor with additional information in order to decide on the best treatment for me. Will it show if I can take immunotherapy? I hear about immunotherapy all the time and see ads everywhere.
Yes. Complete or comprehensive biomarker testing in lung cancer checks for all the recommended biomarkers. The results of complete biomarker testing can provide information as it relates to who should or should not get different targeted therapies or immunotherapies. We talked about the biomarkers for targeted therapies that look at the genetic makeup of the cancer. We also test for immunotherapy biomarkers, which can show how a cancer interacts with the immune system.
As I said, I've heard about immunotherapy. I'm just not as familiar with targeted therapy. How is it different from immunotherapy?
Targeted therapies work differently. Immunotherapy medications stimulate your own immune system to shrink cancer, while targeted therapy medications shrink cancer directly. As scientists have learned about driver mutations and other changes in cells that cause cancer, they have been able to develop drugs that directly target them. These drugs target specific parts of cells and the signals that proteins send to cells that cause them to grow and divide uncontrollably. There are many approved and available biomarker-driven treatments for people with advanced non-small cell lung cancer. Biomarkers that don't yet approve targeted therapies might have treatments being tested through clinical trials. Clinical trial participation is an option patients can consider in those cases. That is another reason why it is important to do complete or comprehensive biomarker testing and find out as much as we can about your cancer so we can come up with the best treatment plan.
I thought I would be receiving chemotherapy through an IV. Is this still a potential option for me?
Absolutely. Your doctor wants to ensure that for you, we have the complete biomarker results before deciding on the optimal initial treatment option. For some patients who already have severe symptoms, doctors may decide to initiate chemotherapy up front while waiting for results of biomarker testing. This isn't the case for you, but you still might be treated with chemotherapy at some point.
I'm worried that the cancer is going to spread further while I wait for results. Is this possible?
We're really not concerned about this. It's really a short period of time, so significant growth is unlikely, and it's very important for you to get on the best possible treatment.
Just a few more questions. How long will it take for the results to return? Will they all return at the same time?
Once again, great questions. Tissue results for complete biomarker testing takes approximately 2 to 3 weeks. The results for possible indication for immunotherapy treatment can return sooner. However, Remember that in order to ensure optimal initial therapy for your lung cancer, the complete biomarker results are needed. Once the results are in, we can meet again if you like to review the report and discuss your results. Also, I just want to remind you about the different resources available that the Nurse Navigator provided to you previously. These will further support you in understanding the terms that we've discussed today.
Okay, great. Rasheda, this has really been helpful and helped to calm my concerns surrounding not immediately starting treatment, and also helped me to better understand the importance of biomarker testing. Thanks so much for walking me through this information and explaining everything.
As clinicians, I think my takeaway points for other clinicians is to understand the role that we play when patients present with this new diagnosis, with new information being thrown at them, and the expectation to understand everything in one sit down. We have to avail ourselves to be able to break down terminology, be available multiple times to explain these terms so that for when patients walk out from us, or when they are talking with their family members, or when they are trying to communicate and understand it for themselves, it is in their terms, under their way, and so therefore they can have a good knowledge base of why we need to do biomarker testing and why it's important to have all the results and why we would like to wait and hold off for chemotherapy. In my experience, I have found that when we take that time to explain to patients, sometimes multiple times, that anxiety level decreases and they have a better understanding of why it is so important in having these results.
I think one of the most difficult things for patients when they get a diagnosis of advanced lung cancer is understanding all of the new terminology that all of a sudden is being thrown at them. There's just so many new terms that unless you already have a background in something medical, that as a brand new patient, it's hard to understand. Biomarker testing, targeted therapy, etc. And even if it's explained to you, sometimes it takes several explanations to really be able to comprehend everything. I always recommend to new patients, if they can, to bring a partner along with them, or any trusted friend or family member to early appointments, especially, so that someone else can also take notes and listen to the explanations and definitions that are heard. Another thing that I also often recommend to patients is that they ask the person they're speaking with if it's okay for them to record the conversation. And if that's acceptable to everyone, then they can just easily record it on their phone and have a reference that they can look back to. I also think fantastic resources are out there. It might be a little overwhelming when a patient is first diagnosed to, digest that these resources even exist. And again, I think reminding a patient about those a number of times is really helpful. Resources at LUNGevity are incredibly helpful and were very supportive to me when I was first diagnosed. And there are also a number of patient groups that have grown up around different biomarkers in the lung cancer community, including the EGFR Resisters group, which I've co-founded, that can really help patients get the support and make personal connections to other patients that can be incredibly helpful when you're newly diagnosed and you don't know anyone else who is a lung cancer patient or another person who is living with lung cancer.
LUNGevity is a patient advocacy organization that is one great source for information and support for patients with lung cancer. They have many educational resources, including short summaries and more in-depth guides on biomarker testing, targeted therapies, and what patients should know about their biomarker testing results report.